How many times have you been handed a laboratory report of your blood and they say, no, everything's in the normal range? They'll say you're all normal, and then you still have the same symptoms. You walk out, you're fatigued, you're having bowel problems or immune problems or cough or sneeze. We can see those things. We can finally be able to open the window, and then we can direct our therapy much more effectively. When we give them a solution for that, whether it's, vitamins or herbs or whatever, they get much better.
Mammography. We know it's an absolutely unacceptable form of screening for breast cancer. But what is? Hi, this is Dr. Mercola helping you take control of your health. And today we are joined by Dr. Dan Beilin, who is here to tell us about an exciting new development in thermography, which makes it even more effective in screening. And that is it's a physiological, functional, dynamic form of thermography. So, Dr. Beilin, welcome, and thank you for joining us today.
Thank you for having me, Dr. Mercola, if I can call you Joe.
Yeah, Joe's fine too. So, and I'll call you Dan. So, in the meantime, why don't you, you have a very interesting history. You're not a medical doctor, you're a PhD and based out of California, but you have this nasty habit of going to German Medicine Week every year, which for those not familiar with it is sort of the premier event for technology and integrative or natural medicine. And I've never been there. It's on my bucket list, though I definitely want to go. And maybe going with you at some point. But as a result of those annual ventures into Germany, you've acquired some understanding and knowledge of some really cool technology, which you've really imported to the United States and are start to offering now as a better form of a superior alternative preventive screening for breast cancer. So why don't you give us the backstory?
Well, the backstory is I started with some of Dr. Voll's friends in electrodermal screening, but it wasn't, the changes between patients, and it was too operator dependent. So all the different practitioners would have different diagnoses. It wasn't really working well. It's okay as a sum test. I wanted something more objective, and I come from a academic medical research background. I was 4 years in neurosurgical research at UC Davis and 3 years in gastroenterology research. So I'm really first a scientist, and I saw how tunnel vision the neurosurgeons were. They were just only focused on what they were attacking, on only the tumor, on only that. And they were trying different therapies, just only that, not even discussing what's happening to the rest of the body while they're trying to kill this thing. They're killing the rest of the body. And the rest of the body is the thing that was responsible for causing the problem in the first place. So how can this be? There's some little glitch in their logic. By the way, I went into acupuncture school, and that's my medical license, and I have a doctorate in Oriental medicine. But while I was doing that, I was doing this research during the day, published many articles with my professors, and just had that kind of a notion, that this whole thing was missing in medicine. First of all, we need to see the body as a functional organism. We have to understand that we have great imaging. We have MRI, we have CT scans. They're fantastic imaging of static body parts, anatomy. But if we're looking to find the cause of disease, we have to go 5 years, 10 years before that tumor has formed. And that's why nuclear medicine radiology has a jump on it, because they look at function, and also cardiology with their treadmill tests. That's a functional test. And what we do is something that was introduced to me from Dr. Schimmel's friend, Dr. Bonas, who said, look at this. Let's look at a test whereby you test the person before and after they're subjected to a stress. So just like the cardiologist stresses you by having you run on a treadmill, we stress you by subjecting your body to the cool air of a normal room temperature. And that's enough to get a fight or flight reaction. And it shows a reflection of the organ systems onto the skin. You see, Joe, we're all connected. We're not just an independent tumor over there, and let's just kill that. We're completely connected.
So, excuse me for interrupting, Dan, but I really wanted to direct the conversation more to the breast cancer screening, which we initially mentioned, and thanks for setting the stage on how this is a physiological functional assessment. But what I'd like you to discuss is the downsides of mammography, or you can just basically skip over that because we hit that a lot, but also the downsides of conventional thermography, which we have talked about before, and really promoted it, but it really has almost an unacceptable high false positive and false negative rate. And then how the new technology, which is functional, physiological, dynamic thermography, differs and why it's better.
Right. Okay. So what we're doing is we're recording temperatures digitally. So we're using the mathematics of a temperature here, 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 here. That's number one. So we're using mathematics. That when I took this device to the chief of breast imaging at Harvard at Deaconess Hospital, she said, and I can quote you, that regulation thermography, this method, and she was very much surprised and happy, is based on mathematics, and this is the future of radiology. All of radiology is switching over, is transforming into computer-assisted diagnostics. And so we're using numerical values and not colors that have been changed. You know that if you take a breast and you take it from one angle and another, because of the wavelength change from taking something that is not straight on perpendicular, you get a slight variation. Well, so all the infrared camera thermographers are getting little differences. And let me tell you something. Most of the cameras out there are calibrated to measure bridges and buildings.
Mm-hmm.
They're industrial cameras.
And they're not really calibrated for medical professionals.
That's right. We made sure that we were using a FDA cleared sensor. We're not only FDA cleared as a whole device, we're FDA cleared even in our sensor. So we're double FDA cleared because that's calibrated to the human body. That means that the human body emits an 8 to 15 micron wavelength, an infrared coming out naturally. We don't do anything invasive. We're only measuring what's coming out of the body naturally. And the infrared camera people are doing the same. But they're calibrated in huge ranges. Well, there's no resolution there. There's no mathematical resolution. If you don't have resolution, you're going to miss things. The other thing is 90% of the infrared people are not doing dynamic measurements. So they're trying to create an image. They want to create an image of the vasculature. They're trying to see if an artery is feeding a tumor. That's useful. I don't say throw away infrared cameras, because the vasculature is a useful parameter. Along with mammography, there's a problem with it. Radiation, if you know any biophysicists, they'll all tell you, or a nuclear medicine radiologist that understand radiation, that if you have a dense breast, there's an echoing back and forth of the radiation, of the radioactive particles. So you're getting 4, 5, 8 times exposure than they thought you were getting with more dense breasts. Our system is using the physiology to understand the dynamics of how well that region is being controlled by the nervous system. You know that there's a new study that just came out of UCLA in the neurology department that says the spread of cancer is enhanced by problems in the sympathetic nervous system. That means that all of us who are stressed and we're going from one place to another and we're just working as hard as we can to do everything that we can, and in the stressful life that most of us lead, we're actually enhancing our chances, if there's a tiny little tumor, of it spreading everywhere. And that's been proving. And that's what our machine is based on, monitoring the sympathetic nervous system.
Yeah,
so we can tell.
Well, thank you for explaining those differences. And I just wanted to insert here and remind people the dangers of mammography, because the basic problem is two, as you alluded to. One is it's ionizing radiation. So every time you get a mammogram, you will increase your risk of breast cancer. No question about it. I mean, I forget how many chest raises it's equivalent to. But then secondly, and most importantly, there's too many false positives. And so what the heck does that mean? If you have 1,000 women getting a mammogram, it will, in fact, about 5 of those women will come down with breast cancer. That's about the ratio of breast cancer in the population and the screening population. So the mammogram will find 1 of those women. It will miss 4. So it will save 1 out of 1,000. But what's the downside? The downside is that of those 1,500 women will be falsely told during their lifetime that they have a positive mammogram. 500, half of them. And of those 500, 10 will actually undergo treatment, unnecessary treatment that could actually result in their premature death. So yes, does it help some women? Clearly, there's women who have benefited, but the question becomes, how many women does it damage, both psychologically and physiologically? So I don't recommend mammograms at all as a
Well,
screening tool. So maybe you can comment on that.
well, some of my patients I send up to UC San Francisco to Dr. Esserman, who's the chief, she's a radiologist and a breast surgeon. She's the one that really promoted and made a reality the breast MRI. So the problem with that has another problem. It's the heavy metals in the dye that they use in the contrast media.
Is
But
that,
the
is that
MRI,
gadolinium?
yes.
Yeah.
So they're looking at new things that are not as toxic. But besides that, that's a very good imaging. We already have in medicine great imaging. We need something to fill in the gap. There's this huge gap. We can't see the function of the body. And with this alpha thermography, it's called the alpha Site 9000, we are looking only at function. And if you have, say, accuracy in mammograms 65%, let's say, that means they miss or do something that's not accurate on 35%. We have around 83% accuracy. We can still miss 17%, and it's different. That means that if you use them together, we're up to a 92% accuracy. If you use just ours, we're doing what seems to be, and we don't have enough studies at this point. We're a new company, we're a startup, we have private investors, we're developing fast, we're international. We have 160 machines out there. If you like, you can call us and we can refer you to your nearest doctor. Or if you're a doctor, please let us know. But it's like you have a circle here and a circle here, and here's the mammography imaging. Here's the imaging, and here's our system. It's different. It's filling in the gap that's missing in medicine. We need functional assessments of the body. Heart rate variability is one, but that's a very far look at the body. This tells you pre-diabetic states. This tells you pre-cancer states. We are approved by FDA for neoplastic conditions. That means that they have recognized that our system can tell us something. If we look at it with other types of diagnostics, we can tell someone if they are developing a condition that could be conducive to a cancer.
Sure. And I've never really been supportive of mammograms as a screening tool, and I think we're both in agreement to that. So this offers a really rational, practical alternative that is safe and effective, far more accurate as a preventive screening tool, and no dangerous. There's no ionizing radiation. All it does is detect the normal infrared radiation that your body typically emits.
It's a simple 20-minute test.
Mm-hmm.
You do it in the morning because that's when your reserves are the highest. It's less accurate in the late afternoon. So up until 2 p.m., it's fine to do. 20 minutes, you're in and out. You get an instantaneous report that you meet with your doctor. But we don't, with breast disease, don't forget, the breast is not only the isolated breast. This is something that's known and it's ignored. This is completely crazy to me. The breast is connected to the lymph system. This goes up into the neck. This goes up into the teeth, even the sinuses. So we have found dental infections at the same time with breast problems. And you know what? The people who have the dental infections remedied, either pulling the tooth or sanitizing it with ozone or however they're going to do it, those people do much better long-term with preventing recurrence than people who don't pay attention to the infection. So other body infections are crucial in treating any threat of cancer.
Yes, indeed, and that's another aspect of disease that your equipment can detect. So, we've been essentially identifying this as a really incredibly far superior alternative to breast cancer mammography screening. And actually, one of the things that annoys me with that, as we're recording this video, I just did some travel, and I'm sure this is in October, the month of October, which is considered the Breast Cancer Awareness Month. So I liked Delta Airlines is my favorite domestic airline, and the last flight I had, they had the flight attendants wearing pink light bulbs, pleading for them to donate to the breast cancer awareness movement and Susan Komen Foundation. I mean, I just get livid when I see these things, because they have no idea what these doing. And the people who donate, I mean, they have no idea, they're unsuspecting, but there's this massive misunderstanding, fraud, and misperception of the reality. And mammograms don't work, and the whole all this cancer funding they're doing, it's for the right cause, but they're wrong diagnostic strategies.
Couldn't they listen to Einstein? They're doing the same thing over and over, and they want to cure this, and they keep putting money into this endless. Why not look in a totally different way? Why are they not coming to us and saying, what would you add? What are we doing wrong? Why are they not coming to the people that have, all of my teachers in Germany are medical doctors. Mm-hmm. Some are radiologists. We even have on our board a radiologist who got up in front of 120 doctors and said, mammograms cause cancer. There's no two ways about it. He's a nuclear medicine and radiologist. He has more physics degrees than top professors of physics, I can tell you. He knows what he's talking about. He knows his biophysics. He's created new imaging devices. And it's obvious. Why don't they come to us and say, why is this? Well, we are going to do a study at Harvard. They've asked that they use our machine. They said, look, infrared cameras are out. The same with FDA. The FDA told me when we were getting this order.
That's conventional infrared. The traditional thermography is what you're just referring to.
Yes, the infrared cameras for breast are not going to be approved anymore by FDA. That's what the top analyst of FDA told me to my face when I was in FDA and we were getting this cleared, because there's just too many false positives and negatives. The other problem is that most of the American companies are using these industrial cameras, whereas there's two German companies that are calibrated properly, and they use a whole different grading system, and they seem to be more accurate. So I wouldn't throw out the baby with the bathwater, but I think that we need more to fill in this gap of assessing patients in a functional way.
So in addition to screening for breast cancer, which is probably the most sought after preventive screening tool, why don't you discuss the other indications that your technology is useful for? Because in the same amount of time that you're doing the breast cancer screening, you screen for all these other diseases and potential pathologies that could be contributing to future disease for you. So I think that's a really, even potentially, the more fascinating aspect of the reach or the indications for your equipment.
We as practitioners, as doctors, we see patients and then we do our thing, and then sometimes we never see them again, and we don't know what happened to them. I get calls every 3 months from patients who say, I didn't think much of your tests, but I went to my dentist at first and he said, oh no, there's nothing wrong. They did a panoramic x-ray, which also has its false negatives. And they said, there's nothing there. That machine must be quackery. They're calling me back 6 months or a year later. Remember that tooth? Remember that tooth? That's the tooth you told me there was a possible infection. They had to remove that and all this pus came out. So we can see things in the gradation of their development. Another is, I had a young woman come to me about 2 months ago with on a CT scan. She had a mass growing on her uterus, in back of her uterus. She came in for us to tell her, hey, is this something I should worry about, or is it like a fibroid that's benign? I said, okay, let's see. So we did our test and we found that there seemed to be normal regulation going into that region. So I can't tell her any diagnosis because we don't have a pathology report. We need a pathology report. She was going in for surgery. They first wanted to do a laparoscopy, which is just the tubes in to look in a, in the lens, but then they decided to cut her completely open. She had this huge mass that looked like a sarcoma, which is very, very metastatic, onto her uterus. They had to do a complete hysterectomy, and poor girl, she was 28 years old and she wanted to have kids. They took it out. They analyzed it, and you know that it wasn't a sarcoma. It was a benign muscle type of tumor. It was a very extremely rare form of a benign growth.
Okay, that's a great story. And let's establish some of the parameters that your equipment and screening is good for. One, of course, is for malignancies, and that not so much even to find them, which is primary indication, but also to differentiate between benign non-pathologic growths that may just need to be removed for mechanical reasons, but not to remove adjacent tissue like a uterus and cause a woman to be infertile the rest of her life. So that's another useful tool. But it also, you had mentioned earlier, the infections, the dental infections. So we have infections, malignancies, non-malignancies. What other type of functional assessment will allow you, what other type of diseases will your functional assessment allow you to identify at an early stage?
Well, here's another one. I'm sure you don't know any people with this. Inflammatory disorders.
No, I never heard of those.
Everyone has them. So diabetes is an inflammatory disorder, along with about 200 or 300 more syndromes that they at first might not have thought were inflammatory. Inflammation is, our biggest problem, because what happens as a result of inflammation is later on following, a disease that's diagnosable. But so we're cleared for inflammatory disorders. We can see inflammation because you know what happens on the skin? Instead of it cooling down, it warms. So when we are subjected to cool air, the area of inflammation warms. So if you have a hepatitis, the area over the liver goes back through the spinal reflex arc. It's called the spinal reflex arc. And it conveys the signal from the organ. So each region that we want to look at is connected through the spinal cord back onto the skin. So the organ, nerve, skin is one system, and we're looking at regions. So we can say, okay, it appears that there may be inflammation here. So then we know what tests to select. How many patients go into an emergency room, say with an abdominal pain, and they do all kinds of tests? They might even do ultrasound or CT scan, and they come out all as negative, and the person has a diverticula that's not discovered until they get a colonoscopy, and they send them home with an antibiotic because they don't know what else to do, or an anti-anxiety drug because they don't happen to see things. Mm-hmm. We can see much more from the functional picture than has ever been able to be seen from that orientation. And this is what's missing in medicine. So just think how many billions of dollars would be saved if we knew ahead of time what are the proper diagnostic tests to do. Is a CT necessary? Oh yeah, it might be, because that's the way you can see a tumor in the abdomen. So it might very well be the right test. But how many of the tests came out? No, nothing's wrong with your blood. How many times have you been handed a laboratory report of your blood And they say, no, everything's in the normal range. Even though there might be thyroid that's really way down here and the other thyroid way up here, and that's really abnormal if you put them together, they'll say you're all normal. And then you still have the same symptoms. You walk out, you're fatigued, you're having bowel problems or immune problems or cough or sneeze. We can see those things. We can finally be able to open the window, and then we can direct our therapy much more effectively.
Well, that's terrific. So the actual name of the process that you're using is important because we want to differentiate it from regular thermography. So you actually use a term called thermometry, not thermography, but thermometry, and put the word regulation thermometry, which refers to the dynamic process or the functional testing that you do, which is to establish a baseline, stress the body to this cold, not relatively, but minor cold exposure, enough of a physiological challenge where you'll see a difference if there's some pathological process going on. So maybe you can expand on that, and
Right.
you can take it to the next step.
Yeah, so we put the data through a system of filters, sort of pattern recognition. And it's not based upon anything I've created. This has been 40 years in Europe. We have 100,000 people in our database. We've assessed what is the normal values for the behavior, along with the Germans. So FDA asked us to compare to our recent population. So since it wasn't quite cleared in the US, we went to our Canada group and our Swiss group, and we gathered the data for the ideal and what we can compare it to, and it came out the same as the old German studies. So we have a 100,000 patient database. We have 160 devices out there called Alpha or ALFA, like the sports car, Alpha Site 9000 companies, Alpha .global or Alpha Thermodiagnostics. And we've shown that we're able to look at any race with the same parameters. We're all the same. We all have similar problems. Some populations have more gut problems. Some populations have more lymphatic problems. It's very interesting. We brought this to Hungary, and I don't know what toxic things are going on there. It must be remnants of war or all the problems they've had throughout the last 50 or 100 years, but all of their teeth go the wrong way. In other words, you're supposed to have your teeth getting a little warmer because of the blood shunting to the head, and that in Hungary, all of the people's teeth get colder. It's a very interesting thing. So we're being furnished with data, and we can watch populations and populational changes with health this way by having multiple systems all over the world. So we have a device in China, Taiwan, Malaysia, Singapore, Thailand, England, Germany, Switzerland, Spain. We're growing, but most of our devices are in North America now. And we're able to really, we have doctors that use the infrared cameras, and they use ours next to it, and they say that's our favorite combination because we can see what's really the cause with the alpha system. We can look and see what's connecting to that problem that the patient says is wrong with them or their doctors say is wrong. Well, so we need to know, every disease we have is not exactly connected to the organ that we think it is.
So you've been practicing for over 3 decades in California, and I think really one of the primary focus of this conversation and interview is to really help the average woman who's at risk for breast cancer clearly and has been relying on mammograms or maybe even thermograms. What would you recommend to this woman for an ideal screening strategy to detect breast cancer at an early age? Not treatment, because we go into that in separate interviews and articles, but we're here for preventive screening.
I would recommend that if someone has never had a history of any kind of cancer, that between the ages of 50 and 60, every 2 to 3 year mammogram may be necessary. I'm not saying don't follow your doctor's wishes and orders, but I see so many women who have been told to get mammograms every single year. That's too much. I believe in tumor marker testing, and there's more and more coming out to be there are circulating tumor cells that happen before, often before a tumor is able to be formed and situated in a particular organ system. I would recommend that. And I would recommend the regulation thermography of the alpha system to look at the functional abnormalities so we can see things up to 5 to 7 years in advance. And I would recommend the normal blood tests and hormone tests, and to understand some of their internal conflicts that they've had in their lives, because there's a direct connection of the psychology and the trauma that some women have sustained to breast cancer.
Sure.
So you know, you can't forget about the mind and how powerful that is in influencing the body.
Yeah, I just was one of the speakers at the Truth About Cancer conference, where they had some really incredible other presenters there, and I was on a panel with about a dozen other doctors, and the audience was asking us questions, and really the consensus to that panel was is that emotions are probably the untreated emotions are probably the most single significant and important influence and factor in most cancers, not just breast cancer. So it's really an important issue, and really not a topic for this interview, but I just want to highlight and
Well,
reemphasize that.
I can tell you, my friend just died from multiple myeloma, mistreated by the oncologists with overdoses of chemotherapy after their original chemotherapy was not working. And we found a tooth infection with the alpha system. He had an impacted tooth in the jaw. He actually had 2 of them. He had one removed, didn't remove the other. He also had a lot of conflicts.
Sure.
When you take an infection on top of having a psychological history of major conflicts, you're giving the cancer a basis to develop.
Mm-hmm.
We can find the infection. We can't do anything with the psychology. That's up to you and only a few therapists, because most of them are just talking and nonsense. You really have to get deep and do very deep work. And
Sure.
without those 2 things,
Yeah, those are really important. You know, the hidden or occult infections and this untreated emotional challenges. And we discussed some of the interventions for that. And energy psychology is one of my favorite application of that is EFT, but there's a lot of other good. Dr. Hammer in Germany has done a lot of work with that, and recall healing is another. And there's just a lot of effective alternative strategies, not conventional counseling. I mean, it can be useful, but usually not as effective as the others. But what I wanted to go back to is your comments on the screening. And I was surprised to hear you say that you would actually recommend regular mammography every 2 or 3 years after the age of 50. And I just wanted to comment that in some cases you may not have an alternative, because if you want your insurance to pay for your diagnostic procedure, as they typically do for a mammogram, they will absolutely refuse to do any additional screening unless you do the mammogram first, because it's inset, it's embedded in the system. This lie,
right.
this fallacy, this misdirection, misperception is part of the whole healthcare system, so you can't get away from it. But I guess maybe I'm more specific with my question. In an ideal circumstance where insurance wasn't a factor, where following your regular medical doctor's advice isn't an issue, what would you recommend? Do you still recommend screening mammograms? I mean, if you do, you do. I'm just surprised to hear you say that.
I look at the risk category of the patient,
Mm-hmm.
and if we can do an MRI, it's more expensive. I would rather go that direction. Without contrast, it has as much definition as a mammogram. So I try to arrange for my patients to get MRIs and cut through the red tape and the insurance, and we do the best we can. So I prefer non-radiation methods.
Okay,
However, yeah. So, however, I'm into functional medicine, I can't tell someone what to do. They have to use what knowledge they have. I can only educate and help to educate, and that's their choice. So
Well,
I
that's what
don't
we're
tell
doing
them, no,
today.
don't do this. And yeah,
That's what we're doing today. And just to comment on the MRI, two major important points. You said without contrast, and the contrast agent, as we discussed earlier, is gadolinium, Gadolinium, I believe. And you can look that term up on my site, and you'll see all the problems with that contrast agent. So you do not want to do it. As Dan mentioned, there's just it's almost equal without the contrast. And here's the tip that I want to share with you, because if you violate the no mammogram issue, there's a good chance that your insurance company won't pay for it. So you could go to the hospital and get it done, and it will cost you an arm and a leg. Or you can go to these centers that are independent of the hospital, and it will be a fraction of the cost, maybe as low as 25% of the cost or lower. I mean, it's just incredible what you can do if you have to pay for it out of pocket.
that's right. So, and it's much better to go to smaller places, then you don't get mixed up in the problems of hospitals and the infections running around hospitals. I have two patients that one just died from hospital infections, and another one we had to intervene because she got such a virulent form of an infection. No antibiotic was working, and we used some of our herbal stuff to get her out of it. But so you want to stay in the small imaging centers, and they cater to people even without insurance. They'll knock their prices down. But we want to see things, and here's the other thing: whenever someone tells a patient that they had a problem, and they go to their mammography or whoever it is, and they say, no, you don't have a problem, that was a false positive, they don't follow them for 5 years. 5 years later, if that woman gets cancer, they were right. It wasn't a false positive. And it's been proven that thermography can see things developing up to 5 years ahead of time. So infrared, the problem with the criticisms of infrared cameras is that they've been wrongly applied in that way. They've been wrongly said, hey, you're getting too many false positives, when a lot of those women develop cancer, but in 5 years, and they aren't following them. So we do the same, but we have, let me tell you something. We have 12 parameters for breast suspicion. The infrared camera people only have 2. The infrared camera people have, if a breast is a different temperature side to side, and if there's a hot spot. And then they can see if there's an artery that is feeding something. That's really only 2 parameters, because that's the hot spot. There's only 2 parameters. We look at the stomach location that's connected to the breast. We look at the lymph. We look at the teeth. We look at the endocrine systems. And we have 12 criteria. So what would you rather have, Joe? Data that's 12, so it's like 7 out of 12, 8 out of 12, to establish a certainty level, or 2 things. You don't even know where your curve is going to go if you only have 2 parameters. But if you have 12 parameters, your certainty level keeps being reassured and keeps being reassured and keeps, or it deviates. And you say, no, you only have 3 out of 12 criteria. Really, I think the most important problem is your pancreas or something else. We can prioritize. Infrared cameras, mammography, nothing prioritizes. 3/4 of all the doctors out there, I don't care if you're alternative medicine or not, are not necessarily working on the priority organ system that needs to be worked on. They're taking educated guesses, even though they have some blood tests and some other thing. They're still taking educated guesses based upon their experience. And no one is really a great doctor unless they've had a minimum 8 years experience. I can tell you how, when I first started practice, how unsure I was, and I would just guess and guess and guess. And then when I had 1,000 patients, 2,000 patients, then you get a certain knowingness. But that's a bias still. I still see patients when I do the thermography test, they're different than what I thought all the time. Oh my God, it appears that you might have an inflammation in the colon when I thought it was in the chest. And then they say, oh yeah, by the way, I have constant diarrhea. I didn't tell you. It's always when they're out the door, you say, are you sure you don't have this? And they say, well, I don't know, but I really have headaches all the time. That's what I want cured. But you have a problem in the gut. No, can you give me something for maybe muscles? Maybe it's muscles. So you give them magnesium or something like this. It's not going to help. That's what most doctors are doing now. They're just basing upon their bias. This system, when you do a system, it comes out sometimes, that's funny. This is different than I thought. And when you get to know the patient and you get to see how they react and what their symptoms continue, you get to know a patient. You find out the thermography, the alpha regulation thermography, or thermometry, because now we call it by digital analysis. So we, coined the term thermometry. We can tell what you least suspected. And when we act on that, when we give them a solution for that, whether it's, vitamins or herbs or whatever, they get much better.
I just wanted to comment on your excellent observation of priority. And I wanted to expand on that concept a bit because there's a similar concept that help people understand it better in most any business, which is called sequencing. Because traditional and conventional medicine, conventional medicine teaches us and gives us, even functional medicine gives a good idea of what might be the problem. But if you don't really order them in the proper sequence, which is another term for priority, you are going to miss the boat and the patient may die because you're not addressing the primary functional cause of what the symptoms are. So that is really an important concept, and this functional dynamic thermometry allows you to do that. It's really this powerful way to do it. And personally, if I was a woman, if I, the same age I am now, I would be doing this every year. There's no question in my mind I would be doing it. So along those lines, and I was so compelled when I met you at the Conquering Cancer Conference in Orlando through Lee Cowden, and actually you sought me out during that, and I'm so glad you did. I mean, you were one of the first people I talked to at that event, and I was so impressed that one of my new missions is to convince not only the public, like we are doing now, how important this tool is, but also clinicians to purchase this equipment, because we used to do thermography, conventional FLIR-based camera thermography in our clinic, which we don't have anymore, but I would exchange that camera in a heartbeat for yours, and it's not it's like the cost of an MRI scanner or something. It's reasonably priced. It's like the total unit, I think, is under $20,000. But what
yeah,
is
it's half the price.
Half the price of the other camera. So and it's far more effective. So for the clinicians out there, please consider doing this, because there's only 160 centers. We're going to put links to where that you can get that now. You can call your place. We'll make it easy for people. And so where they can find these centers across the country, but the key here is that it's still going to be likely, you'll be lucky if it's close to you. So we want everyone to have these cameras, we really do, or this equipment, so they can be screened, because believe me, the need is far in excess of what traditional mammography is. So we need as many of these cameras out there as we do mammograms. It's going to be a process. So this is the first part of that process. So why don't you expand on that and tell clinicians how they can get a camera and what the cost of the test is and how they find someone.
Yeah, so they can go onto our website where we have a listing of the doctors that have it, or if you put in your zip code, we'll tell you your nearest one. And the website is alpha.global. The email for our company is info@alpha.global. And we have an 800 number for you, 844-527-8673. We need to have a couple of thousand centers in the United States. Now we have 150. Really, this is going to be thanks to you. You're a fantastic venue for us, and you understood this immediately. I'm very, very impressed with the status of your nervous system, Joe, and I really appreciate all of this. But I think that I even do my own body every 6 months, and it really is a test that everyone should do every 6 months. They should get a baseline, and let me tell you that every thermography data sheet, which is the raw data, and I can show you this, is a fingerprint of your own individuality. So we actually get a reflection of each person as an individual. And as we treat, we can retest in a month or how long the medicine would take to take action. And we can see that we chose the right way. Mm-hmm. Because if we say we have 5 liver remedies, and we have a liver inflammation, and we can choose a Chinese herbal, we can choose an American herbal, we can choose a homeopathic, we can choose an antibiotic or something, and then we retest in a month, and we only got 10% of that inflammation to go on the thermogram. We know that we need to switch the choice. So we can actually you can follow a cancer patient, you can follow a diabetic patient, you can follow the patient through and to test whether and this is completely objective. This has no influence, like the electrodermal screening techniques and a lot of the other methods that are popular now, the Zyto and all that. There's a lot of subjective difference between day to day. Like if you do the same test tomorrow, it comes out different. That's impossible with this. This is absolutely reproducible. If you do nothing, 5 years later, you're going to have the same thermogram. Some things might get worse. I've had patients that come in and I say, look, I really think that you have a suspicious breast. You need to do something about it. You need to image it in some way, and we need to take care of this. And they've said, no, I'm just going to do my prayers. I'm just going to do my prayers, and that's all. And I go, well, okay, if you're really, really good at prayers, then it should work.
Yeah.
But I wouldn't rely on it 100%. You've got to do something. And I let them go, and 6 months later, they get 4 times worse.
Yeah.
And then they go. And then they need surgery and chemo.
Well, that's
could have prevented that.
That's the beauty of your technology, because it's this independent, objective assessment that, I do my blood test every 4 weeks approximately because I'm obsessive compulsive. But, if I had one of these equipment, I'd probably do it every 4 weeks just to compare what you're doing, because you're going to have an intervention. And prayer, no question, is a valid intervention. It could be the most potent intervention. But let's test it. Let's get a baseline. Pray for 3 months, 6 months, and let's retest and see what happens. If nothing happens, then you might want to consider something in addition to prayer. So, this is the baseline test, and I'm so passionate about doing this. And I didn't mention this earlier, but I get no commission for this. I get no benefit other than getting the mental joy and satisfaction of seeing premature pain and suffering and disability prevented. And your technology is a powerful intervention to achieve that. So, we have no financial relationship at all. So I just want to, this is independent, this is objective, this is my decades of really being passionate about health and trying to find the best technology and tools to help you stay healthy. And this is one of them, believe me.
Yeah, well, we're working on the software to have Chinese medicine, Ayurvedic medicine, and integrate that worldwide. I'm a little bit hesitant to bring it into China because they might want to copy it or something, but we do want to bring it into leading hospitals in India. We want to make a less expensive model for the poor and bring it into rural areas, and we can still monitor world populations. So we're interested. We're in about our 3rd round of funding, so we're open to. We have more stock available if anyone out there is interested. But we're doing very, very well, and we're developing fast, and we're modifying the software to be more accurate all the time.
Terrific. All right. Well, this is a great tool. In fact, we're going to talk after the interview about me getting a camera locally to where I live so I can access. I believe so powerfully that I want it myself. I mean, you mentioned every 6 months, but there's no danger or harm other than financially to measure it more frequently. I want to do mine every month. You do yours every 6, but I'm an obsessive compulsive, so I want to do it and see where it is. It only takes 20 minutes, so it's a pretty easy test to do.
Yeah, and you can't exercise in the morning.
Yeah, yeah. The first time it reminds me of the first time I had it tested. I came to your. I had my. You did me first, and then the following day after we met, it was like 7 o'clock. But I had already been to the gym and worked out, and pumped up that I had to come back the next
Yeah,
day. In the morning before exercise. So that's another key point. You
yeah.
can't
When you make your
physiologically
appointment,
stretch yourself. Yeah.
yeah, and you can't drink hot coffee, and hopefully you're not in there with your spouse that you've just been fighting with. But I can tell you that once we had a Qigong master I was testing. He had some problems, and he when during the cool down period. So we test the initial points all over the body. Takes like 5 minutes to test each individual point. And then we have you sit in the room for a 10-minute period where the body is acclimating to the new temperature. And then we go back over the same points. In the cool down, this guy was doing this. His hands were like this. And I said,
Mm-hmm.
"Are you doing Qigong?" And he goes, "Yeah, I'm a Qigong master." So I said, "Okay, stop doing that right now. We're going to do the rest of the test." You know that his thermogram came out like a Superman,
Mm-hmm.
that nobody ever gets, that would be a testimony to his abilities as a Qigong guy. But I said, "Look, you have to come back tomorrow, and you can't be doing anything. You just have to think about nothing, or think about, the forest, or taking a walk somewhere." And then it showed us what we needed to see.
Well, it also seems like a very powerful anecdotal validation of Qigong. It's something
Or
I've
any
explored.
meditation method.
Yeah, I mean, that
Just
really, it improves your physiology, which you're able to determine.
And we can see how good people are to know where they stand, so they can study more, or they can, be more diligent. So if they're into yoga, if they're into Tai Chi, or if they're into anything, meditation, it could be used that way. But what I see every day is, hey, I was bitten by a tick 6 months ago. I don't feel well. Do the thermography. We have a signature for Lyme,
Mhm.
and it's very interesting. Uh, we cor- uh, we correlated this with some IGENIX tests, one of the labs here in Palo Alto,
Mhm.
one of the leading labs for Lyme assessment. And every time we saw these front head points get cooler instead of warmer, the person had a positive Lyme. So we're still working with it, but it looks like we found a Lyme signature. We can also see pesticides in the brain. We can see pre-Alzheimer's. I had a patient yesterday whose brain points were all too cold. So these are points on the scalp. They were all too cold to begin with. And we call this a brain toxicity. There's some kind of toxin. And he had just been exposed to a tremendous amount of pesticides, Roundup, by the way, for in his garden. I have a patient right now in Germany who's getting whole body hyperthermia because he has sarcomas grown all over his internal organs. He came into me stage 4. They gave up on me. The thermography showed a tremendous amount of blocked regulation, but really cold values in the brain. I said, "What is this? Is this pesticides? It looks like pesticide poisoning." He said, "Well," I said, "Do you use Roundup or anything like that?" He says, "Yeah, I've been using Roundup in my garden for 10 years. I think your audience doesn't need to know much more about Roundup, but from what I understand from the French team that did the research, it's one of the most poisonous substances available to everybody today."
Yeah, well, Dr. Don Huber, who's a professor emeritus at the Indiana University, I believe, really an expert in plant pathology, identifies this as more dangerous than DDT, far more dangerous than DDT.
Oh yeah.
So it decimates your microbiome, it chelates really important minerals you need to function in a really good way. So it disrupts important metabolic pathways. So it's something you want to avoid for sure. And it's pervasive. It's absolutely pervasive. So I want to get back to You know,
But
you interchangeably use the word thermography with regulation thermometry, but just so there's not a confusion on that. But what is, so it's at 160 centers there. What is the average price? I know there's a range depending on the clinic that's offering it. So it takes 20 minutes. You got to do it in the morning, 7 o'clock or so, before exercise, before,
no, you can do it.
well, before
You
2
can do it
p.m.
anytime from
Before
7
2 p.m.
until 2. Right.
7 till 2. So no hot coffee or anything. And so what's the range in the cost of this service, this test?
Oh, between 225 and 650, depending upon really the license. Our radiologist, I think he charges 650, but mostly in the $200 to $300 range.
Okay. So, and I have not been offering services with a clinic for a while. So what is a normal thermography, non-regulation thermometry cost
The
range?
infrared camera, I think around the same.
Okay,
I
around the
think
same.
around the same. But the
Okay,
problem
that's
with
good to
that is
know.
that
Yeah, good to know.
the report has to go to a expert with the infrared camera. Very often chiropractors that analyze them. So they're not really radiologists. We have radiologists on our board that's reviewed our whole system, and the charting goes immediately with our system. With regulation thermography, goes right back immediately. So so the doctor can meet with the patient immediately after his test and have all the information he needs.
All right, let me expand on that a bit, and clarify that for someone who might be confused on what you just said. And I've had the opportunity to go through the process. So essentially, you'll take the readings pre-cold exposure, then post-cold exposure. All that data that's generated and collected goes into the software. The software is uploaded to the cloud where this analysis occurs, and then you get a report back. And that the clinician can then review the report in real time. You don't have to wait a day, a week, a month to get the results.
Right. And then you sit down with your doctor and he explains by looking at the raw data and everything else in a friendly way so that he can work with you. You guys are a team. So it allows you to look at the colored image of the body that's colored of the physiology, not imaging, but the physiology. And it's exactly what we want to see, the dynamic ability of the body to adjust to stress.
Yeah, so it's a little bit different from that perspective because a regular infrared thermography will show you these colored images that directly represent the temperature of the tissue that it's analyzing. But yours doesn't just do that. It's far deeper analysis. It's the physiological dynamic response to the cold intervention. So you're not, there's probably some correlation to temperature, but it doesn't have to be. It's more the function and the physiology.
Well, we see both. We see the original temperature, and that's what the infrared cameras are seeing. But
Okay.
then we look at the dynamics and the behavior of those points over those organ regions.
Mm-hmm.
So this is the missing window of medicine.
Mm-hmm.
That's why we have the cardiologist. That's why we have more and more functional tests in medicine. Nuclear medicine is exploding because they inject you with a dye that goes to a specific organ that shows you in sequences how that organ is dealing with that contrast media, and to see, okay, the kidney appears to be emptying that stuff out pretty well, so there's nothing wrong with the kidney. We're doing the same thing, only without a chemical, totally non-invasively.
Yeah, safe as can be. Yeah. So I think we've given people enough of a flavor. We'll probably have you on again to expand on this in your update, because the beautiful thing I like about this too, you are just the tip of the iceberg. You are generating lots of data and you're developing what's called these signatures, which have strong clinical correlation to disease states. And because the technology is so relatively new, you just haven't had time to accumulate enough data.
No, but we have from Germany, we have 40 signatures
Yeah,
that
40
have all
signatures.
they've all been corroborated with the patient's laboratory data. So when we see a pattern, say in the gut of candida, which is a fungal overgrowth in the gut, those people have at one time or another been tested with a stool analysis that shows huge amounts of candida. All of this has been confirmed by 40 years of laboratory confirmation. So I didn't make anything up. I went to the experts in Germany and had them dictate all the parameters for the recognition. of these patterns. So we're not making anything up.
Sure.
However, over the next years, we'll be able to find more patterns like the Lyme signature.
Yeah, and that's what I'm really excited about, because one of my other passions is technology, and it's very clear that one of the most exciting emerging concepts in the tech field is deep learning, where we have these very sophisticated computers and software that can analyze large data sets like you're creating and make these incredible correlations that are really almost beyond the human capacity to do. So I want to work with you in tying you into some of these deep learning systems, because I think the potential is really quite enormous to uncover a lot of other hidden signatures that are there, but you just don't know because the analysis hasn't been done yet.
Absolutely. You know, there's a third nervous system called the polyvagal system that is the work of a professor in, I believe, South Carolina, who said that our face shows our polyvagal system. That means that we should be able to take temperatures of the face and correlate them with deep emotional conflicts. And that's actually been done to a certain extent. We intend to develop that even more.
That's exciting, because as we referenced both earlier, and both strongly agree on, and I think almost any expert would not deny, the important influence of emotions to our health, and certainly for the risk of cancer. So that's a very exciting, because emotions are so hard to quantify. There's no objective test, but if you've got this independent, objective, easy to do test and relatively inexpensive, that's non-invasive, very safe, and you can diagnose an emotional pathology. Oh my gosh. And then you can not only diagnose it, but then you can test if the intervention is effective.
Yeah, it's very interesting in bipolar patients that might be in a remissive phase, or they might be medicated. We can still see a huge division in the behavior of the points in the head and the rest of the body. It's actually cut off right in the mid chest, where these points are very hot and these points are actually toxic. So you see the lower body has an over-regulation. That means when we stimulate with the cool air, those points overcool much more, like 2 degrees different, even in a room temperature of 70 degrees, your normal room temperature. We only need a normal room temperature. It doesn't have to be a special room. And we're able to see up to 40 patterns that have been clarified and identified over the years. So it's not a new system. That's a major advantage that we have.
Yeah, and as you mentioned earlier, it has FDA approval and clearance, and even for diagnosing malignancies, which is an unusual.
No,
I'm sorry?
no, I wouldn't. I mean,
Okay, it's not diagnosing. What
you
is it?
can't go to the diagnosis. A diagnosis of a malignancy is only through pathology.
Pathology, so a biopsy, but it's a suggestive of malignancy, and it's approval for that, right?
So it'll direct the doctor to the proper test to diagnose.
Right.
So FDA, and I agree, this is an adjunct diagnostic device.
Right.
That means
Not the primary.
use it with every, but you know, all of our tests are adjunct.
Sure, absolutely.
If you look
Certainly mammography is.
If I see an abnormal A1C on the blood test, that's an adjunct to diagnosing diabetes. I still will need to do like a glucose test or other tests. So many tests are adjunct, but our test is only an adjunct, but the information and the education towards the patient and towards the doctor is tremendous. It's much greater than we ever expected.
Okay, well, thank you for joining us today, for developing this technology, for committing to your passion, for going to Germany, learning about this, bringing it back to the United States, and then offering to so many people. And I'm really hopeful that we can explode the number of centers and that carry this tool. And I'm pleading with you, if you're a clinician, to seriously consider integrating this tool. Obviously. I'm sorry. Yeah,
come to our website.
They'll take care of you there.
We'll have a PDF that will give you a printout of what to take to your doctor that explains this. Or if you're a doctor, it will explain it more. And then you'll put in your zip code and it'll tell you where your nearest center is.
Yes, and you're doing everyone a service, and actually you'll financially reward yourself too, because the unit will be paid for itself relatively quickly. We're going to be promoting this approach widely, so you'll have a large stream of individuals who really are seeking the service out because it's so phenomenal. Not only screen for cancer, but all these other diseases that you can identify far before. Because remember, everyone knows this, and I'm just going to remind you: an ounce of prevention, pound of cure. Simple, valid concept, and that's what we're talking about here. Preventive, valid, safe screening tool. Absolutely different than mammography. So
And
thanks for
that
promoting.
goes for the whole world. Really, Joe, that goes for the whole
Oh,
world
sure.
because
Yeah, I'm
you
biased
don't
because I'm
know.
an American.
No, if
Sure.
you're an American, it's one thing to say prevention, but I can tell you that I go to Malaysia, Thailand, Singapore. Those people, those poor people, know nothing about prevention. They have amazing amounts of chemicals in their environment. They know nothing about prevention, and they come in one after the other, stage 4 cancer, stage 4 cancer. Why? Well, I just didn't want to do anything. I was too scared. This is an incredible system that will go worldwide to give the first education of these people to taking care of themselves.
That's terrific. All right. Well, I think we've done a nice job of covering it. And again, I encourage everyone to look at the resources we're going to include lower down on this page and go to Dan's site. Would you repeat that site again, Dan?
Global. It's very
Alpha.global.
simple. There's no dot. It's not
ALFA.
.com.
Yeah,
Yeah,
alpha.global. It's not ALPHA, it's ALFA dot global. No dot com in there, alpha.global. All right,
exactly.
that should get you to the site. Simple strategy, and then hopefully you'll take advantage of this, incorporate it into your preventive maintenance schedule, and I think you'll be
And we'll
receive the benefits benefits of
and
knowing things before they happen. Which in there, it's a lot easier. Not only is it more effective, but it's a lot easier to treat at that stage.
yeah, thank you so much, Joe, for having me. This is great,
Okay.
and I'm going to keep you in the loop constantly with how this all turns out. But I really appreciate your time.